Are you 100% ready to explain ECT in your CASC exam? Hi everyone, I'm Dr Clarke and welcome back to my channel. In today's video, we're unpacking one of the most misunderstood treatment options in this really common CASC scenario, explaining ECT. The patient will likely have heard of ECT and seen it negatively portrayed in the media or in films. So you'll need to contain those fears and explain it in a calm, structured and genuinely compassionate way. The combination examiners love. I'm now going to walk you through exactly how to do that. Sharing easy to remember lines you can insert right into your ECT explanation station in your real exam, so that you too will score the highest marks. You are seeing Mrs. Stanforth, a 62-year-old inpatient with a severe depressive episode. She has not responded to antidepressants and remains unwell. Her consultant has recommended ECT as the next treatment. Mrs. Stanforth is unsure about ECT and is worried it might affect her memory. Your task is to explain ECT and address her concerns. Hello, Mrs. Stanforth. My name's Dr Clarke and I'm one of the psychiatrists on the ward. I understand your consultant mentioned ECT to you as one of your possible next treatments. Would it be okay if we spend just a few minutes discussing what that would involve, what to expect, and go through any worries or questions that you may have? This opening is great because it shows empathy early on, sets the agenda for the review, and obtains permission before launching into the explanation. Before I explain, could I ask what you've heard about ECT and what worries you the most about it? Listen, validate fears about film and media portrayals or concerns around memory loss. It's completely understandable to feel nervous. A lot of people have seen ECT portrayed really negatively in the media or in films. But ECT has been around for over 80 years now and it's changed a lot in that time. Modern ECT is a safe, carefully monitored medical procedure which has helped many people recover from depression. The aim of ECT is not to shock you, it's to lift the cloud of depression which you're in. Would it be okay if I explain exactly how ECT works now? This part works so well because it acknowledges the patient's fear with empathy, normalises their concern, and then gently reformulates ECT in a positive and reassuring light. It also uses reframing by taking a fearful image, shock, and replacing it with one of hope, lift the cloud. It also smoothly transitions from validation, saying it's completely understandable, to education, showing both warmth and confidence, exactly what examiners and real patients respond to. I personally like to highlight how long ECT has been around and emphasise the major advances that have been made over the years too. ECT is usually offered when depression is very severe or other treatments have not helped enough, as I understand has been the case for you. It's one of the fastest and most effective treatments that we have for treatment-resistant depression, often considered the gold standard, and studies show that about 7 to 8 out of 10 people experience rapid, significant improvement with its use. ECT can also be used when symptoms are very distressing or affecting health. For example, if someone isn't eating, sleeping, or functioning well. The aim is to help your mood improve more quickly than with medication or therapy alone, especially when other treatments haven't helped enough. This segment personalises the explanation to the patient while clearly grounding ECT in evidence-based practice. It helps to instill hope and reassurance by highlighting encouraging outcome data. ECT is carried out in a dedicated treatment suite with a psychiatrist, an anaesthetist and specialist nurses all present. Before each treatment, you'll be given a small general anaesthetic and a muscle relaxant, so you're fully asleep and won't feel anything. The muscle relaxant also makes sure that your body doesn't move at all during the procedure. A very small, carefully controlled electrical current is then passed across your head to cause a brief seizure in the brain. That seizure seems to reset the way certain brain chemicals work, and it can lift your mood quite rapidly. Afterwards, you'll wake up in a recovery area and you may feel a little bit sleepy or have a mild headache, but that usually settles within an hour or so. Most people have around 8 to 12 treatments twice a week, and many start to notice real improvements after just a few sessions. Common short-term effects include mild confusion, headache, or muscle aches just after the treatment. These normally settle very quickly. Memory problems can also happen, particularly right around the treatment. For most people, this is temporary, though occasionally some gaps in memory may persist. To reduce this risk, we can give the treatment to just one side of the head instead of to both sides, and this method tends to reduce the impact on memory.
Remember to normalise concerns.
It's absolutely normal to worry about memory, but we will check and adjust the treatment if needed. Serious complications are very rare. The risk of death or major medical problems is around 1 in 100,000, which is lower than many other medical procedures which use a general anaesthetic.
This section on side effects clearly conveys the risks of ECT in a calm, honest and reassuring manner. It addresses common concerns, uses accessible language and offers safety statistics that build trust and confidence.
ECT does not cause epilepsy. The seizure is brief, controlled and only happens under close supervision. And you won't bite your tongue as we use a soft mouth guard to protect your teeth and tongue during the procedure. Before ECT, you'll have a full medical check, including of your heart and your blood pressure. Because you have mild hypertension, the anaesthetist will make sure your blood pressure is well controlled during the procedure. ECT is generally very safe, even in people with medical conditions. I want to reassure you that this isn't something you have to decide on right now. You'll have time to think about it, talk to your family and ask as many questions as you like. If you want, I can arrange for you to speak with the ECT nurse or see the treatment suite, so it feels less unknown for you. There are also NHS leaflets and online resources which explain ECT really well, and I can make sure you get a copy of those today. How does that all sound so far? What are your main thoughts or feelings about what I've explained so far today?
Allow her to express lingering fears and acknowledge and normalise ambivalence.
It's completely okay to feel unsure. The important thing is that you have all the information to make a decision that feels right for you when you're ready. Thank you for speaking with me so openly today, Mrs. Stanforth. From what you've shared, ECT could be a really good option for you to consider, given everything you've already tried. I'll make sure you have some written information, contact details for support, and plenty of time to think things through. I want to reassure you that whatever you decide, we'll continue to work together and support you and help you feel better.
This approach, which I've demonstrated today, works really well as it shows empathy and normalises fears, explains the rationale, procedure and safety of ECT clearly, discusses risks including death and benefits honestly, and emphasises choice and informed consent.
Putting all of that together, this approach really helps you show the examiner that you can remain calm, structured and compassionate under pressure. Give this station a go with a peer when you can, or record yourself explaining ECT using the tips that I've outlined today. If you've made it this far, you're already ahead of most candidates, because you now know how to explain ECT calmly, clearly and compassionately, so you'll absolutely stand out in your real CASC exam. Thanks for watching. If this video helped your confidence, then like and subscribe so you don't miss out on my next video, where we'll be tackling how to explain graded exposure and systematic desensitization. And remember, in every explanation station that you get on the day, breathe, slow down, chunk and check, and connect with the patient early on. That's what turns an OK mark into an excellent pass.
If you found this video helpful, please consider subscribing. Every subscriber really helps me keep making and improving these CASC videos. Thank you for your support.